Good day everyone, I'm Professor Shahid Hassat and you are watching the examination of the neck lump, which is the first microlearning content as core procedure that every student must know how to examine the neck for lump. The lump examination and the lymph node examination go hand in hand, but for the convenience and for creating the microlearning content, we have divided them into examination of the neck lump and examination of the lymph nodes. The whole session will take you 7 minutes to watch through. The learning outcome for this session is to examine a patient with neck lump in ENT setting. Before you put your hand to examine a patient with neck lump, keep some of the differential diagnosis or the common conditions that may cause neck swelling. This will help you in suggesting a diagnosis based on physical examination. Before you start the examination, wash or sanitize your hands, introduce yourself to patient, explain the procedure and take the consent. Check if patient has pain and reassure the examination to be a comfortable experience for the patient. Also check if the patient is aware of any lump in the neck or elsewhere in the body. Start with inspection for any scar, lump, skin changes, ulcer, discharge, punctum or any obvious pulsation. Give the patient sips of water to swallow and with neck extended, watch for thyroid mass and also perform tongue protrusion test to look for the thyroglossal ductus as the midline lump. Next, palpate the neck both from front and behind, explaining each procedure involved before you examine the patient. Palpate for neck lump as usual of a surgical patient, including the major salivary glands, and also auscultate if required. Assess for fluctuation and pulsatility if mass of vascular origin, and do auscultate for bruise suggestive of aneurysm. If the lump is identified, suggest investigation, most likely the fine needle aspiration cytology. Now it's time to watch the video how to examine a neck lump. However, the session has been divided into neck lump and lymph node examination separately, though they will go hand in hand in normal situation. Hello, I'm Dr. Shahid. I'm going to examine you for your complaint of the swelling in the neck, right? So, want me to examine?
Yeah.
Okay, done. Okay. Okay, that's it. Okay. So normally in examination of the neck lump, we have to have, if I'm a ENT surgeon right-handed, then my table should be on my right hand with all my instruments over there, and the patient sits with me with the legs crossed. Then we start examination. So first of all, I would like to have a close look at your neck, right? So an examination inspection, I will look at any scar or any swelling or any other lesion, right? I might ask, can you do little swallowing movement? Yeah, okay, to look at the trachea moving, and if thyroid there, it should move along with this swallowing movement, okay? So ask her to take a sip of water and hold it in your mouth, okay? Okay, hold it in your mouth, and when he asks you to swallow, then you swallow, okay? Can you swallow? Yes. Again? Okay. I feel slight swelling on the right thyroid lobe. Neck extended slightly, open your mouth, take the tongue out, in, out, that's it, close your mouth. Any other lump also, what we have to do is, we have to examine this for the temperature on the surface, margin, right? right? And surface is smooth or irregular or multinodular and all, and margin. Temperature, change in color, if any lump, change in color of the skin, the pulsatility, right, whether it is pulsatile or not, fluctuation also can be cystic or firm or to solid and all, right? And then you have this way, right?
Yeah.
Can you extend your neck a little bit? Okay. Is that bothered you?
No.
No tenderness?
No tenderness.
But you feel there's a swelling?
Yeah.
Okay. So examination usually is done with the flat of our fingers, not with the tip of the finger, otherwise there's going to be an artifact. So we use flat of the finger to examine. You can use 2 fingers, 3 fingers, depends, right, for the mass that has been pointed out by the patient, right? So we do this, hold your neck this, and then do gently, then ask patient to turn neck to the opposite side to make it, if the swelling is prominent, and then also if it is hiding under the sternocleidomastoid muscle, then you can use another finger and do under the sternocleidomastoid, but the neck has to be slightly flexed so that you can easily go under this and see. So, okay, then, okay. So I'm going to go behind and examine you, right? So in a very systemic order, for the lump, again, I will start with the complaint that the patient has, a lump or in this region, right? So examination, again, turning the neck to the opposite side, so make it a little more prominent in case, but I hardly feel any swelling over there, okay? 2 other things would be about the trans-illumination. For trans-illumination, if you have a swelling, just simply put your torchlight to the swelling, right, and examine from the other side. For example, if there is a swelling there, so I'll put the torch here and examine from the other side, and at the same time, the trachea and see whether the trachea is in the midline or not. Is it deviated or not? And apart from inspection and palpation, we should do auscultation as well, right? So auscultation particularly for buoy. So what we do is we put over the thyroid, we put this thing and we auscultate, right? We auscultate from here and then we auscultate here, right? The thyroid lobe, either thyroid lobe, right? This is auscultation particularly done for the buoy, okay? Now summarizing, after having sanitized my hands, I introduced myself to patient, explained the examination and the procedure to be taken, and took the patient consent. Later I started with inspection of the lump for any visible scar or skin changes. Next I approached the patient in a systemic way, moving behind the patient and explaining about the examination and requesting to have adequate exposure of the neck and move the neck from left to right if required. I also asked the patient to swallow sips of water and watch for the thyroid movement. Besides, the patient was also asked to stick out the tongue and take it back in case if a midline lump of the thyroglossal duct cyst was suspected. Other specialized tests like transillumination as well as auscultation for suspecting a vascular mass or aneurysm was also done. It would have been nice if the bimanual palpation for major cerebellar gland was also done, though was not demonstrated in this video. Now quickly take the quiz answering 3 questions and goodbye.